Hello and good morning, dear viewers. You're most welcome to the DAKTARI show, and this is a health educative show for you, our viewers, which brings to you matters of health concern and educates you on things regarding health to prevent these common illnesses in your home and also prevent the illnesses and worsening of your lifestyle, maybe in the home settings outside there. Of recent, a study was done that 3 in 5 people die as a result of these accidents or emergencies in homes after being rushed to the hospitals because there are no interventions done. However, if interventions could be done for these people, 1 in 5 of these people would have died, like to reduce the rate from 3 in 5 to 1 in 5. I'm your host, Sunday Junior Tom, and today we have our guest, Mr. Herbert, who is going to take us through some of these emergencies, these accidents people get in homesteads, and what can be done in order to do those home remedies before you rush this person to the hospital in order to reduce this death rate from 3 in 5 to 1 in 5. You're most welcome to the DAKTARI show, Mr. Herbert.
Thank you very much, Mr. Sunday Junior Tom.
Yes.
Once more, good morning, dear listeners and viewers. I'm called Herbert Ofuti. I'm an emergency nurse, majorly based in emergency care. I'm very much pleased to come for this show. Thank you very much for the introduction.
All right, thank you too, Mr. Herbert. We are grateful to give in your time and come and educate the viewers of West Nile TV. So maybe we can pick on from there. Just what is an emergency?
When you look at the definition of an emergency, I will define emergency. Basically, let me come to accidents. Accident is a sudden happen which causes harm and death to the body. We are not sure, we don't know the formula of accidents, when they will happen and when we don't know the date or the whatever date or time it is going to bring. That's what we don't know about accidents. It's a sudden happen. Either it can cause death or harm to the body. When an accident happens, it becomes an emergency. Emergency means something which needs an urgent intervention. If we don't take an urgent intervention in it, either we may lose a life or anything which may happen. Either we lose a body part, if we not only necessary life. So when I define emergency, I will state it as a condition which needs urgent intervention to save a life. That's what I will define. When you look at the common accidents or emergencies which happen at home, majorly to the kids, it's burns. Majorly these kids which crawling at the crawling stage, they go near fire and they pour hot water or whatever and fire on them. So I will ask you people to pay attention. What intervention you will do to save these babies or these kids when they get a burn? What are the first steps you people have to do?
Yes.
Have you people ever asked that question? On most occasions I've encountered kids with burns brought to the hospital or in any health facility, of which the community tries to do some intervention, but interventions are not what we expect. Dipping them in sugar, putting toothpaste on them, to stop the burning process. Some end up rupturing blisters. One thing I would like you people to know about burns today is never ever rupture a blister. Leave the blister there. The moment you rupture a blister, you are going to cause an infection. That part under the blister where the fluid, the plasma accumulates, is sterile. Leave it there. Even when you come to the hospital, that is the same thing we keep emphasizing to our fellow health workers. Never ever rupture a blister, except a blister will rupture on its own. So today I'm asking you people what to do in homes, in the community when a burn happens. One thing, you have to remove the burn, stop the burning process as soon as possible.
All right. So now maybe to ask Mr. Herbert.
Yeah, thank you.
We are going to look into the burns. What things can people do, especially the mothers, do to put their children at risk of getting these burns?
Mostly, thank you very much, Mr. Presenter. What you see with this burn, the burns mostly, these mothers tend to rent fireplaces high. And secondly, these kids are abandoned at home. They are not monitored. One thing, you monitor your child. You have to put these fireplaces at a distance from the children. like the kitchen, you can lock it or you keep it you monitor these children very well. That is the first thing we have to do if we are to prevent some of these accidents at home. That's the first thing these people should be sensitized about. Prevention, prevention of burn prevention. That's the first thing they should do.
Okay. So now we suppose someone in the community, and maybe a mother was reckless on the child, and the child has gotten a burn. Which things can the mother do immediately to help this child before rushing the child to the hospital? Because in most occasions we see people rushing these children just direct to the hospital without any form of intervention, and this can put the health of the child at risk and deteriorate, and maybe the child may lose their life.
Thank you very much once more for that question. What I would like to give to the community, to the homes today, immediately when a burn happens, the first intervention should be to stop the burning process as soon as possible. Secondly, you have to remove the child out of the burn area. And the third thing you have to do is try to remove the burn, the clothes, the tight clothes on this child, which the child has entered in the burn with. You have to remove them. If there are some jewelry, though some people do put jewelry on their children, remove them out. Those are the things you have to do. Secondly, a cold compress. You can get a clean piece of cloth, dip in cold water, apply on the child to stop the burning process. That's the key thing they should do in the first place.
Okay. So now,
by nature, it also has a burning nature. When you are brushing, you can experience it. Now I've got this burn. The wound is open, you again put a toothpaste on it. The burning process continues, creating that blisters, those wounds more. And then definitely...
now you have told us it's not advisable to put the sugar, and also not advisable to
ever notice from them. Which puts their life at the risk of infections highly. That's one thing I've noticed. Only a few cases where I've noticed toothpaste and sugar being applied, but majorly these mothers, due to anxiety, they rush these kids without any other clean intervention done.
So now, whenever like a mother has come to the emergency department and have brought maybe a child who has a burn, maybe on...
One thing you have to know is there is always fear and anxiety. You see, these mothers come weeping, crying, shouting all over. One thing, you have to calm them down. You lay their anxiety. You talk to them. You do some counseling. Secondly, what we go doing is we cover these children, because the moment this skin is exposed, there's heat loss. You cover them. The next thing is we do cleaning using sterile instruments and materials. You clean them around. After cleaning, we do what we call gauze dressing, wet paraffin gauze dressing.
Maybe to cut it short, I've heard you say you clean with sterile instrument and water. Someone may ask, why do we clean?
He's asking here. Someone will ask me, why do we use sterile? Reason why we use sterile instruments or material is, one, we are trying to prevent risk of infections and materials for cleaning the burn wounds. Thank you very much.
Okay, so now you are still taking through the interventions you guys do in the hospital, so you are still on the dress.
Thank you, listeners, once more. We are still on the interventions, as these mothers usually bring their children or burn victims to the facility. When you people bring us these children or the babies to the facility with burns, what we first is anxiety. The first thing we do is to allay your anxiety. Secondly, we position your child in a good position, basically on the bed and on the back. What we do, as I mentioned, we clean this child, we clean the burn area. After cleaning this burn area, what we do is there's fluid loss in burn. The fluid loss, you may not notice. It may be under a blister. Those swellings from burns, that is already fluid loss. That blister is going to rupture, fluid escapes. There's heat loss. Kids, these burn children, that's what we do. We first of all allay the mother's anxiety or the parents' anxiety. Secondly, the kid is also scared. The kid may be crying. We give a painkiller. There are various types of painkillers that we give because this kid is in pain, we clean this kid, as I said, using sterile instruments and materials. Those are the goals. After cleaning, we apply now the Vaseline gauze dressing on this kid at the various type of burns. Why we use a Vaseline is the next day when we are changing the dressing, we don't want to cause harm to this baby. Remember, removing that dressing from the burn site, it's painful. So when the Vaseline is there, it removes it softly without any problem.
Actually, it's even the skin may peel off.
The skin is loose, of course. Have an extensive burn all over the body. Mostly we wrap them in a cavera. There's a cavera, I don't know mostly how you call it. People use for sealing gifts. Yeah, you first
wrapping
of all wrapping paper, exactly. You first of all cover this child in a clean piece, in a clean cloth, which the mother might provide, or their burn seats in the hospital. There are some basically sterile seats in the hospital. We call them burn seats. They are sterile. We wrap this child. We cover using a wrapping paper to prevent heat loss. Heat loss. Okay. Basically, that's what we do in the emergency unit.
Okay, thank you very much, Mr. Herbert.
Yeah,
actually, once I was in the hospital, I was in a section, I found some child had burns. I found they had some cage. What's the use of that cage?
Mr. Presenter, thank you very much for bringing that point. It's one point. That cage, as you have describe it.
Yeah, actually, look at it as
it looks like a cage. The shape looks like a cage. It's called a bed cradle. A bed cradle. Why we are putting a bed cradle is a bed cradle will prevent the seeds from getting stuck on the skin. You remember when you put these seeds there, due to the wound, the seed may get stuck there. It's also painful. So at least we keep the patient under the bed cradle with the seat over, to present the
direct
contact with the skin. That's why we put a bed cradle.
Okay.
Yeah.
So now, when you're managing this child who has burns in the hospitals, are there expectations like you always need?
We need with these mothers, the mothers should try to cooperate with the health workers. At times when we are working on these children, one of the challenges I've ever experienced is, however, this child gets burned. One thing I mentioned to you, we don't burst blisters, not so? Yes. We don't burn blisters. These skins, they are loose skins. We have to remove them down. However much painful they are, those are dead skins. We remove them such that we clean the site for dressing. One challenge I've seen, when you are removing this dead skin, the loose tissue, for cleaning or for dressing, these mothers keep on shouting, they keep instructing you, please stop, please stop. That's what I've been experiencing. So one thing I want to let them know is they should try to cooperate with us to understand we are not harming the child, we are trying to save the child's life. That dead skin is the same thing which will cause infections, what we call a superficial burn. It just involves the skin. Yeah, it's the skin on the skin surface. It's a one thing you have to also do as these mothers come. One of the ways to allay their anxiety, you talk about the types of burn. Tell them this is a superficial burn. It does not involve the tissues. In 2 weeks' time, it's getting better. Don't worry.
So superficial means in 2 weeks.
Yeah, in 2 weeks they get healed if properly managed. Then when you go to second-degree burn, it involves the tissue. Second-degree burn involves the tissue. There's tissue damage, which may need maybe close monitoring in the wards. Because then when you go to third-degree burn, it may involve the muscles. The muscles involved. It is a deep burn. Very reddish in color. You see, you are likely to see the muscles there. Those are the burns which majorly need keen and strict hygiene and procedures followed when working on them.
Okay.
Yeah.
So thank you very much, Mr. Herbert.
Thank you.
Okay, you told us all these people, you give them antibiotics. Then you also said you dress daily and also give the painkillers.
Exactly.
Okay. However, there are some people, whenever they are healing from these burns, you find, like, let's imagine someone got a burn on around this elbow region.
Yeah, elbow region.
So when the burn, like, let's say it was too deep, when this person is healing from after you guys have managed, you may find like this hand can no longer function very well. What could be the reason, and what interventions do you always do for that person?
Thank you very much for that highlight about that. When you look at a burn, a person healing from a burn, what makes the hand not to move when a person is healing? There's what we call a contracture formation, contractures. You see, the skin now doesn't heal in its normal position. One thing I would like to also let you people know is when there's a burn, what leads to these contractures, sometimes it depends on how we bandage these parts when dressing. And we have to advise these people, these patients, on bedside exercise like limb movements. I got a burn, I've been keeping this hand in this position since I got the burn. There's a high possibility I'm going to develop a contracture here. It may heal like that. So when this skin heals like that, moving it like this becomes a problem. Prevents movement because of the contractures. That's what is causing that, the first thing which causes that inability to move the limb after movement. Basically, that's it.
So how do you always manage these people? Is there hope that this hand can be restored to function?
Advice on physiotherapy, bedside exercises. As you're healing, you can keep moving this hand slowly as you're in the bed. Even the patients in the hospital, it's advisable when you're on the bed, you keep doing some exercises, limb movements. When you're on the bed, that's basically the advice you do, the physiotherapy.
Okay. So also maybe as you're managing these people who have burns, nutrition-wise, which foods do you encourage the mothers to feed the children?
Nutrition-wise, we recommend high fluid intake because there's already fluid loss. Vitamin C.
Even also the exposure of the skin, so it's losing a lot of water.
Exactly. There's heat loss, there's fluid loss, there should be increased fluid intake, there should be high vitamin C intake which promotes healing. Basically, that's what we advise on. I will advise high fiber diet to prevent constipations. As they're on the bed, those are the things they should take.
Okay, could you also recommend for proteins for these children?
Definitely, because these are still children who are still growing. It's advisable we give the various food nutrients, protein, carbohydrates, energy-giving foods, bodybuilding foods for them as they're in the wards with the burns.
Okay. All right. So you have taken us through what burns are, the types, the management.
We call it a wet gangrene. That's majorly what these people what happens in the community. If these things are not well managing, sepsis also leads to death. That's one thing I want to let you people know. In fact,
to these mothers in the homes, in order to prevent burns from continuously occurring in the homesteads.
Thank you very much, viewers and listeners, to the mothers out there, and not only to the mothers, to the entire community. One thing I want to let you know, in whatever form, whatever condition, whatever disease, whatever, prevention is the key. Prevention. Without prevention, there's no way we are going further. One thing we have to do, how do we prevent these burns? As I told you earlier on at the beginning of the discussion, mostly these burns come as a result of negligence, our negligence to these kids. We find we put the ovens or the stoves at the veranda, kids are from the kids to raise the heights. That's the key thing we have to do. Thank you very much. That's the message I want to leave here.
Okay.
Of course, based on my research, always when I'm taking history, how did this child get burned? It's only that one history given for the entire burn patients I've ever encountered. It's what I've experienced.
Okay.
Thank you very much.
All right. Thank you to Mr. Herbert. So now you have taken us through these preventive measures. Maybe you can remind our viewers, in case, because we're almost coming to the first segment time.
True.
So before we go into this short commercial break, you can first remind, like a recap for our viewers, those who have just joined, on how they can manage a child who has gotten burns, and also remind them on the other cream you said.
Thank you very much, presenter, viewers and listeners. I know some people may be viewing, some people may be listening, whatever mode you are using. Burn, first of all, burn is an injury caused by wet or dry heat. Dry heat can be from fire, wet heat can be steam from oven, kettles. That's the definition of burn. It can involve tissue destruction or skin destruction. That's the definition of burns. Causes of burns, it can be from electrical, thermal, or radiation energy. Those are the causes of burns. Coming to types of burn, we have three. We have the first, we call them degrees of burn. We have the first degree burn, we have the second degree burn, we have the third degree burn. First degree burn is what we call a superficial burn. It involves the skin. Second degree burn involves the tissue. Third degree burn, it may involve the tissue and the muscle deep inside. Hope you get me clear. To the community, mothers and various stakeholders, as I told you earlier, first aid management of burn at home should be stop the burning process as soon as possible. Note that very clearly. Stopping the burning process as soon as possible.
You remove the child from the source
of burn, exactly. After removing, I know some of you put cold water, apply on the child to stop the burning process. Next, what you do, cover this child with a clean cloth to prevent heat loss, okay? And there may be open wounds. You also covering from flies and other things that may come to the wound. Thirdly, if this is a child, breastfeeding child, if the child is able to breastfeed, continue breastfeeding. 1 to 2. Some of you may have. I know some of the communities you are well versed with these analgesics or painkillers. To the children, I advise mostly Ibumol. It's a syrup which consists of ibuprofen and paracetamol. You can give it to your child there before you bring to the hospital.
Reduce the pain.
Don't give it overdose, maximum of 5 meals orally through the mouth. Cover this child. One thing I want to let the community know, referral, urgent referral is part of management. When you refer a child or a patient, that is management. Urgent referral to the hospital. The rest of the things, the hospital will also teach you how to do them. Thank you very much.
Alright, thank you very much, Mr. But maybe you can also tell us the cream you said it's called silver.
About the cream, what I said, it's advisable. 2 weeks back, I had a thought. I said, one of the things we have to do, one of the things I've noticed, it's unfortunate, there are some victims we do lose. If we were to educate the community on things to do, I'm sure the community will save their life. We shall just come and do the other things. But since the community also lacks knowledge, it's advisable if we sensitize the community on first aid priorities, what the community is supposed to do. One, if there are some things which will be home as first aid. One, if you people have a bandage at home, there are some first aid things I will mention here. I want to advise you people today, keep them at home. One, it will be a bandage. Key, it will be a bandage. For the burns, keep that silver sulfadiazine cream. It has brand names of burn cure, Agoban. Keep that thing there. In case of burn, after
has been an exciting first segment also.
Sometimes inside, entertainment inbuilt.
West Nile TV, lighting up the region.
Hello and good morning, dear viewers. We'll be back from that short commercial break. It's still the Daktari Show, which is a health educative show which airs here on West Nile TV every Thursday from 10 a.m. to 11 a.m. where I, your host, Sunday Junior Tom, brings you people in the medical field to come and educate you on these like conditions, emergencies, and also nutrition regarding maybe also pregnancies, who come and educate you on how always to live healthy lifestyles. With us today we have Mr. Herbert, who in the first segment took us through an emergency which was mainly banned.
West Nile TV. Our second session here, we shall have a discussion about the road traffic accidents which majorly happen in the community. When you look at these road traffic accidents, mostly me, I prefer abbreviating them as RTA. In our short terms, it's a RTA, road traffic accidents. What are road traffic accidents? If I may ask you viewers and listeners, what do you understand by road traffic accidents? In simple terms, these are accidents which happen on the road. It may be from a vehicle knock, a motorcycle knock, a bicycle knock. Those are all road traffic accidents. It may be a knock, it may be a head-on collision, or whatever form, or a car overturning. Various type of road accidents do happen.
Okay.
Thank you very much.
All right. Thank you to Ms. Herbert. Maybe you can take us through a highlight on which things can cause this road traffic accident.
Majorly, one message actually I want to give to you people: what causes road traffic accidents in Uganda, in West Nile, in Arua, I've seen is recklessness.